Welcome to another MU Healthcare Y107 Ask the Expert podcast. I'm your host and a morning show host, Cosmo from Y107. You know, Women's Hospital committed to empowering women through prenatal and delivery process every step of the way. You're going to hear this a lot in this podcast. No two pregnancies are alike. Every single one of them is different, and that's why Dr. Megan Johnson is here to talk about some great things at MU Healthcare with labor and delivery. Let's do this. You guys offer low-intervention birth program. Why is that important?
We sure do. So some women want a birth experience that's in a more home-like setting, so they can experience birth as a normal, healthy process with minimal medical intervention. At Women's Hospital, we offer the region's only low-intervention birth program, and it's really focused on giving women with low-risk pregnancies the choices that they need to have the best birth experience possible. For some women, that might mean using the tools that are in our low-intervention suite, such as the labor tub, some birthing balls, chairs, swings, TINS units for muscle stimulation, all to help minimize the pain and discomfort of labor and avoid an epidural. For other women, that might mean using the wireless fetal monitors that we have to allow for as much movement around the room as possible, rather than having just the bed as their only option. And for other women, that might mean starting out using these other tools, but then opting to use other medical pain interventions, such as an epidural, as another tool to a successful birth. The goal is just for women to experience birth with minimal medical intervention, with the safety of being in a hospital setting and cared for by expert doctors and midwives.
How is MU Healthcare on the forefront, really, with innovation when it comes to care for these moms to be in patients?
At MU Healthcare, we offer both the traditional one-on-one appointment patients have with their doctors, as well as group prenatal care. So group prenatal care is a really unique way to experience healthcare. It's really centered around this premise that people thrive in community. We are not meant to go on these journeys alone. We are not meant to go through life alone. Women can really benefit from the support, the knowledge, and the experiences of other women around them. In the group prenatal care setting, women attend appointments together. It's a longer, more relaxed setting. It allows a lot more time for education, discussion, and support. So women spend 40 weeks of their life, almost a year pregnant. And so this group prenatal care setting allows a safe support system for her throughout her pregnancy, and these relationships can even extend beyond pregnancy as well.
MU Healthcare's Women's Hospital committed to empowering women through prenatal and delivery process. And OBGYN Megan Johnson is with us here this morning talking about more about MU Healthcare's services offered. Why is it important to pick a team like yours, an experienced team of doctors, when you're pregnant and expecting?
Well, women in mid-Missouri deserve the safest birth experience. Being at an academic center like MU Women's Hospital means women have access to the most comprehensive women's health team in mid-Missouri, ranging from midwives to OBGYN physicians to maternal fetal medicine specialists who are experts in the high-risk pregnancies and deliveries. Whether a woman is best supported by a midwife model of care or she needs more critical care resources, we are all on the same team, so we can provide her with what she needs for the safest, most supported birth experience possible. Giving birth is a transformational experience. Our team of experts is really passionate about supporting women through that process in the safest way possible.
What is the baby-friendly designation from MU Women's Hospital?
Well, of course, all hospitals are friendly to babies.
Right.
But this term baby-friendly is a certain designation that's given to hospitals that put special policies in place to support mothers and babies during their first critical few days of life. For example, we actively do skin-to-skin time between mother and baby immediately after birth. We really train staff hard about how to help a woman initiate breastfeeding within the first hour of her baby's life. The overall goal is just making health outcomes as great as they can be, providing as much education as possible, and helping to support each mother's feeding goals. Some women feed their babies with formula. Some women exclusively pump. Some women exclusively breastfeed. Our goal is to give each woman, regardless of her feeding goals, as much education as they can have so they can be successful. We work hard at this, so we're really passionate about helping women be successful in their feeding goals, whatever those might be, and about optimizing those health outcomes.
No two pregnancies are alike. Obviously, that's something I'm sure that you say every single day. Every story is different.
Right.
MU Healthcare's Women's Hospital, proud to offer you more options, more expertise. Download this prenatal and delivery guide, muhealth.org/expecting. Obviously, sometimes a C-section is necessary. So what is gentle C-section? How does that work into things?
Well, we are so fortunate to live in a time of modern medicine when we have C-section as a tool if we need it to safely care for mothers and babies. Sometimes a scheduled C-section is needed for medical reasons. Sometimes a C-section is not part of the plan, but quickly becomes part of the plan. Either way, we want women to feel present. We want them to feel calm. We want them to feel confident for their birth experience. And we want them to feel connected to their baby, even though it might be an alternative birth route. So the gentle C-section is about creating that environment. We dim the lights. We play them whatever music the patient wants. We make the environment really quiet. And we also have this great peekaboo drape. We lower part of the drape, but there's still this big clear window through which a woman can see her baby being born. Then they can kind of touch through the window. They can say hi to each other. It's this really beautiful moment. And then as soon as the baby is safely transitioned to the outside world, we get them snuggled back in, skin to skin, as soon as we can. We try to get latched on if that's what the mother's goal is. We just really try to continue to help facilitate those bonding goals, those feeding goals, while helping a woman have the absolute safest delivery possible.
That's amazing. Thank you so much for your time this morning. Really appreciate it.
Thank you.
Because, again, no two pregnancies are alike. MU Healthcare's Women's Hospital, proud to offer you that option and expertise that no other provider in Midmo can offer. Download that prenatal and delivery guide right now. Or when you get to work, muhealth.org/expecting.